Hello, and thank you for tuning into our Facebook Live Q&A, where we'll be discussing how to keep yourself and your community safe as we continue to navigate the COVID-19 pandemic. I'm Elizabeth Van Camp, and I'm a member of the UI Healthcare social media team. I'm joined by UI Hospitals and Clinics Chief Medical Officer, Dr. Theresa Brennan, who will be answering your questions about the still present risks of COVID-19. So please submit your questions and concerns you have in the comments, and we'll answer as many of them as we can. Thanks for being here today, Dr. Brennan.
Sure, happy to be back.
One note before we begin, this video is for informational purposes only. So if you're feeling sick or you're concerned about your health at all, we encourage you to contact your primary care provider or schedule a video visit to talk to a provider. So Dr. Brennan, it's been a few weeks since you and I have done a Facebook Live together.
Yeah.
How are you feeling about the continuing pandemic?
I think in general, when people ask that question, they're looking for, I feel positive or I'm concerned. I think, the big thing that I think most of us are feeling is tired of it. We've been putting into place these safety measures for a long time. Some of them are easy, like washing our hands. But the social distancing is still challenging, particularly now in the summer. Maybe we'll talk about that a little bit later. But the wearing of masks is hard, and just not being back to normal. So I think most of us are tired of this and hoping that it'll go away soon, and it probably isn't going to go away soon. I think from a medical standpoint, I feel that we've learned a lot. We're learning more. I mean, I've said before that one consistent thing about COVID is change. We change our thoughts, we change what we know, we change how we're supposed to do things. But I think we've learned a lot, and I think that I'm really pleased that there is more discussion about face coverings in the public, and even our government seems to be more in support of that. And so I'm really pleased about that because I think it's really important.
Yeah, we've recently started talking this week about the 3 W's, which it hopefully will help people remember these small little precautions they can take every day, which is wear your face covering, watch your distance, and wash your hands. Very simple, but like you said, it is a change to our life. Some of us we're not used to keeping our distance or wearing our face coverings, but if we can do those little things, we're going to see progress in the right direction with COVID-19, right?
Yeah, I heard one of our leaders in one of the, and I think we'll talk about this too, in one of the epi discussions, talk about we need to wear it now so we don't have to wear them later.
Absolutely.
I think that's really important because I think perhaps some people feel like, I just don't ever have to wear it. And I think it's important that with any sort of quality improvement or any sort of initiative to initiate change, whether it's an infection or other things, you really have to have a high level of people in that community and that population that are following the recommended standards. And face masks or shields are definitely one of those that we really need everybody to wear them now so we all don't have to wear them later.
Absolutely. So COVID-19 cases seem to be leveling off just a little bit in Johnson County, but that's not necessarily the case in some of the other parts of Iowa and the other parts of the United States. What can we all continue to do to help our communities start to kick COVID-19 to the curb?
Yeah, I think it's the same things that we just talked about, that, wear your mask or shield, wear your face covering, watch your distance, and in particular, being careful about even when you're outside and watching your distance, if there's potential for you to come in contact with someone, make sure you have that face covering available to you and continuing to wash your hands. And I think also to really make good choices. I think we've talked about in the past that, it's necessary for us to open the economy and, address whether schools are open or not. And all of those things are necessary. And we probably can get back to some of those things. But the best way to do that and the best way to make sure that we don't do that and allow COVID to spike again is to do it in a safe manner.
Absolutely. So you did touch a little bit on it's summer and we're outside a little bit more. So with that in mind, what are the riskiest activities that we should be avoiding right now? And is it safe to gather outdoors still?
Yeah, so let me address the first part first. So riskiest things would be things that really violate those safety standards, and or are less, allow those standards to be less protective. So anything indoors is worse than anything outdoors. The ventilation outdoors is better than it is indoors. And you have more space probably for most people. Now that it's a little cooler out, that's a little easier. When it was really, really hot, I think it was really challenging for people to be outdoors. So, anything that allows you to share things. So, if you go to a potluck, that's bad. Don't go to a potluck. Right? We don't want to share food. We don't want to share utensils. Those sorts of things you want to avoid because they're risky. And the second part of your question, remind me again.
Is it still safe to gather outdoors? Because a few weeks ago we were saying, if you have to gather, try to do it outside. Is that still safe? And if it is, what are the things that you still recommend doing to keep that safe?
Yeah, the word safe is relative, right? So, I've used the analogy of driving a car. So, there's various safety things you can do to drive a car that make you more or less safe. And so I'm hesitant to say anything is safe, but I think that there are things that we can do to make things safer, right? So outdoors is safer than indoors, but you still want to keep your distance, right? You still want to maintain that social distance, that 6 feet. And if you can't do that, and even if you can, when you're gathering with people, there might be someone that comes up, to you within that 6 feet that you aren't prepared for. So having your mask or your shield either on or readily available, even if you're distancing, really important. Continuing to wash your hands. And then, my comment about the potluck was designed to be a little bit funny, but it's really not. I mean, I think it's important that if you're going to a gathering, perhaps bringing your own food, your own drinks, your own utensils, to make certain that there isn't that sharing of things. I think the last thing I would say is that these are all choices, right? Each of us has the ability to make our own choices. And those choices really depend on what that gathering is, where it is, is it outdoors, is it indoors, how many people are going to be there. So smaller gatherings are safer than larger gatherings. And I think each of us looks at our own personal situation, what our medical conditions are, how old we are, who we're exposing potentially when we come back from that gathering. So I think all of those things go into consideration in making that choice of whether you go or not. And I think thinking about how you can optimize that safety is really important.
Yeah, thank you for those reminders. And I know Dr. Salinas had covered, especially for families with younger kids, things like going to the park. Like you said, it's not necessarily safe in and of itself, but there's things you can do to make it safer.
Right.
And one thing that I've been thinking of is keeping hand sanitizer with you. Like we put a thing of hand sanitizer in our stroller, because that way it's always there. And if we choose to go to the park, we can do so in a little bit of a safer way. Do you have any other tips on how people can, make that safety just a part of their daily life, or any recommendations?
Yeah, no, I love the hand sanitizer. There are little, the travel ones that you can attach to bags and things, and those are great. Yeah. Sorry, I'm getting an update here. I'm going to defer that. And then I think it's just being prepared, making sure that you have a face covering available to you if you don't have it on.
Sure.
Thinking about where you're going. If you're going to go to a park and there's something going on at that park, and there are going to be a lot of people, perhaps making a different choice. But I do think that we all have to do what we can to get back to a more normal life, because the mental toil of COVID is real and serious. And if we can do things in a way that's safe, that gets us closer to what normal used to be, I think that that's good for all of us.
Great. Thank you for those suggestions and those reminders. So there's some questions about why, floating around social media and the internet in general, about why COVID-19 is considered a pandemic, but other illnesses and viruses that affect large amounts of people maybe aren't considered pandemics. Can you explain the difference there for us?
Yeah, early on in COVID, there was a lot of discussion. Is it an outbreak? Is it an epidemic? Is it a pandemic? And there are descriptions of each of these. An outbreak is a cluster. An epidemic is a number of people that are getting an infection that in a fairly wide geographic area. When that extends beyond that, where the transmission seems to be faster, more people are getting infected, it's a wider area, particularly for COVID-19, where just like influenza, it is an international disease and affects every country. It's doing it at a faster rate. And so that's why we call this a pandemic. There are many years when we talk about influenza being an epidemic, and it worries us greatly. I think the bigger concern about COVID has been that the mortality seems to be higher.
That makes sense. Thanks for breaking that down for us. What do we know about asymptomatic spread of COVID-19?
Yeah, we know it's real. And I think that's the most, if of all I'm going to say in the next few seconds, that's the most important thing for you to know. Whether it's 25% or 40% or more than that, we're not entirely clear. And I think it's going to take widespread testing and really lots more data and people looking at it to really know. But we do know that it happens. And I think because of the fact that we know it happens, it makes us more alert to the fact that we need to wear our face coverings. We need to follow these safety practices with distancing and washing our hands. I do want to make a distinction. So sometimes we talk about asymptomatic, meaning, I guess we should just say what the definition is. That means someone has no symptoms. That means that someone might have COVID-19 and feel completely normal. They don't have a cough, they don't have a sore throat, they don't have a fever. They feel just fine, and they wouldn't have known it had they not had a test. Differentiating that from what we call pre-symptomatic, which means that today I feel fine. I might have had a COVID test today that says I'm positive, and then tomorrow I start to have symptoms. I think that there are certainly people that are in that group. We've certainly seen that here at the University of Iowa Hospitals and Clinics, as in many other hospitals. We're testing asymptomatic patients that don't show any symptoms, but are going to have a procedure, or those that are getting admitted to our hospital. Those are two groups that we are routinely testing now. And we do find that sometimes someone will become positive who had no idea. We've also seen that those people, some of those people tomorrow will call back and say, I have symptoms now. So I think the differentiation between asymptomatic and pre-symptomatic is important. But just to go back to the most important thing is that it is clear that people can have COVID and not have symptoms and can give it to someone else. And so that's where those safety practices are so important.
Yeah, that is really, really good to know. So can you remind us why face masks are effective at slowing the spread of COVID-19? Because I think there's still some confusion about why they're effective.
Sure. So face masks are simply a barrier. And we know that COVID-19 is spread by droplets. So the person who has the virus expels those droplets when they cough, when they sneeze, perhaps when they laugh. So those droplets can go out into the air, and we believe the most common transmission is that they actually come in contact with another person right away. So that's why that distancing is so important, and that's why masking is so important. The mask basically prevents that droplet from going places. So a cloth mask, we talk about being source control. So the source is the person who's wearing the mask, and the cloth mask itself will keep those droplets from spreading in the air, from falling on surfaces, and from having the potential to infect other people. It is important to recognize that the masks, whether it be a cloth mask or a medical grade mask or even a respirator like an N95, they're not a complete barrier. It's not like plexiglass where nothing gets through, right? And so, the difference between those masks are what can get through, what size particles can get through. And so that's why we know that when you are in contact with someone who is generating an aerosol, who has COVID, we want a respirator. For most of us during our normal days, a standard face covering like a cloth mask or a face shield is certainly adequate and preferred.
Thank you for breaking down the distinction there between the different kinds of masks, because that's also been something that's concerned people, is whether or not a cloth face mask when they go to the grocery store or the doctor is a good enough barrier. So you would say in general for everyday use?
Absolutely.
Great.
And we know it works. I mean, I can tell you here at the university, I mean, we have a lot of people who are in contact with each other every day, and we're trying to follow all of these safety standards. But most of us are wearing a shield only. We're not wearing, a medical grade mask unless we're with patients in a patient care area, for sure. I do want to add one thing, Elizabeth, that so I've had questions about, well, why don't we all just wear a medical mask? If we know that a medical grade mask is better than a cloth mask, why wouldn't we all just wear medical grade masks? It seems like we have reasonable supplies now, right? Well, a medical grade mask is good for one use for a short-ish amount of time, several hours probably at the most, and then it has to be thrown away. And so if you think about everyone having to use a medical grade mask every day in the United States and in every other country, though it appears that our supplies are quite good now, or are better now, we certainly don't have the supplies for that. And we don't think that it's necessary. We believe that with source control, and we've seen that in areas that have been more aggressive about wearing some sort of face covering, a cloth mask or a shield, that they're able to decrease the transmission. And so that's the reason why cloth masks or shields are preferred for most of us who are not in hospitals or in places taking care of patients.
Yeah. I've got a couple questions and that relate to what you were just going over with us. Can you explain how face shields also can slow the spread of the droplets that the virus is spread by?
Sure. So the face shield is a barrier as well. And the difference between a face shield and a mask is it is actually a less permeable barrier. Things don't get through it. It's solid, so to speak. It, though, doesn't fit your face like a mask does. So I actually have my shield here. So this is the shield that I wear most of the time. When I see patients, I wear a more robust shield. But what you can see is that it comes around. So when I put it on, it comes around my face and it comes below my chin. And those are the things that we really want to see when we use our face shields. So if I were to cough, and we see that when we clean our face shields, if I were to cough, I would see droplets on my shield. It also, prevents, because of airflow, it prevents things coming right at me. So it helps me to be somewhat protected from others. So that's why we have chosen to use shields as opposed to cloth face masks. And the other two big things are that it's really hard to touch your face when you have the shield on. You have to actually try to do that. And then the last thing is that it's cleanable, where, medical grade mask has to be disposed and get a new one, and a cloth mask you have to wash regularly, every day at least. And I think that that's another really important thing about the shields. They do protect the mask underneath. So when we're seeing patients, we wear our shield and we wear our medical grade mask. And that not only protects me from the patient, but it also protects the face mask from getting contaminated, which then protects me, because then when I take it off, there's less of a risk to me. So it actually does a number of things. And unfortunately, there's no data head-to-head saying it's better or worse than cloth masks. But, our experts feel like it's a very good face covering to wear.
Great. So in terms of face masks, a lot of people are wondering, how can they ensure that their cloth face mask is effective in preventing droplet spread? So what are the things you should look for when you're buying one or making one?
Sure. So you want it to be knit tightly enough that it doesn't let things through. So cotton is best. You also want to have more than one layer. So the standard really is to have 2 layers. There was some discussion, I think, from the WHO, several weeks ago about whether it should be 3 layers or not. But I think most experts believe that 2 layers is adequate. You need to weigh the risk and benefit of the challenge with breathing through it versus the number of layers that are protective. So 2 layers. And then I think there's a couple of other things that sometimes we don't think about. So it should be comfortable to you, right? If it doesn't feel comfortable to you, you're going to be, fussing with it. You may take it off at times when you shouldn't take it off, and it needs to fit well. So it really should go onto your nose and fit around your nose. It needs to come up under your chin and have a reasonable fit there. And it really should fit well on the sides of your face. And so people can decide, do they like those that have strings to tie? Do they like those that have elastic that goes around your ears? There's also people who have used what have been termed ear savers, where they're little plastic devices that you can attach to the sides of the mask so it doesn't feel uncomfortable on your ears. So that fit is really important. And then the last thing is they have to be washed. You need to wash your cloth face mask regularly, at least once a day. You shouldn't go multiple days with the same mask.
Yeah, I was just talking to one of our epidemiologists, and she just kept emphasizing there's a type of face covering for everyone, no matter what your preference is, no matter, like you said, if you like the ones that tie or the ear loops, or you prefer a face shield, there's so many options, and there's definitely something out there that will be comfortable for you to wear. I know I've even experimented a little bit with what kind of mask makes me feel most comfortable, like you said, so that I'm not fidgeting with it. So that's something to keep in mind, is that there's really an option out there for everyone.
Yeah, I mean, you could consider it almost a little bit a part of your wardrobe, right?
Mm-hmm.
So, if you have a pair of pants that don't fit very well, you're probably not going to be very excited about using or wearing them. So the same would be for your face mask. So find something that you like and have a couple of them or a few of them, so you can put them in a rotation and wash them regularly.
Great. So we recently launched a video series on our social media called Epi Explains, and they're short videos from our epidemiology team or other experts at the University of Iowa Hospitals and Clinics. And last week, we shared a video with Dr. Greg Schmidt explaining how face masks do not impede your breathing, and they don't make people retain carbon dioxide. So if someone missed that video, could you just explain what Dr. Schmidt went over?
Yeah, I think the first thing I'll say is that, much of what we hear about COVID out on the internet or in the media may not be validated or may not come from an expert. And I would say Dr. Schmidt is an expert. He's a critical care doc who sees a lot of patients. He's been doing it for a long time. He's a leader in our hospital. And so, he is definitely capable of addressing this issue, right? So what he showed was that you can look at what we call your oxygen saturation, how much oxygen is in your blood, and you can do that with a simple probe that we put on your finger. And that when you have no mask on, or when you have had a mask on for a couple hours, that oxygen level is the same. Mm-hmm. He also showed that we can measure something called end-tidal CO2 or carbon dioxide. So it's what we breathe out and what's in that area around your mouth and nose when you're breathing. We can measure that. And he showed that with someone wearing the mask for 6 hours, that their end-tidal CO2 was the same as it was prior to the mask going on. And we would, so that's important, because if CO2 is building up in my bloodstream, I would be trying to get rid of it. And so that end-tidal CO2 would go up. Sure. It's a good non-invasive measurement of what the CO2 level is. And we actually use it medically on some of our units in patients who have some breathing trouble or who might be getting medicines that make them sleepy, to make sure that their CO2 is staying okay. So he showed both of those things. I think the one thing that is important also to recognize is that when you put on your mask, you might feel like it's affecting you. So when we do medical tests, it isn't affecting your oxygen. It's not affecting your carbon dioxide or your CO2, but it may physically cause you to feel like you're short of breath, or like you're uncomfortable. And that is a feeling, and it's real, and it's important. But I think what he really spoke to is that medically the mask is not harming you.
Yeah, I had a doctor's appointment at our Iowa River Landing location the other day, and I was wearing a cloth mask, and I was like, I'm going to take the stairs today. And I went up 4 flights of stairs, and I got to the top, and, I'm like, I feel more winded than usual. Is it just that I'm out of shape, or is it the mask? I think it was because I'm out of shape. But I know what you were talking about, because I did for a moment. I'm like, okay, I can see what people mean of feeling like maybe this is affecting me. But I also, when I, took a step back, I was like, no, I'm okay. I'm okay. It was just that temporary discomfort. So I'm glad you touched on that, because like you said, it is a real feeling.
I would say if the mask gives you no sensation that your breathing is different, then maybe it's not doing its job, right?
Mm-hmm.
It's supposed to slow flow.
Mm-hmm.
So you may have to work just a little bit harder, but the reality is, medically, it is not changing your oxygen level or your carbon dioxide levels. Now there may be some patients that have more medical conditions, that are really concerned that maybe for me it would be different, and I would just refer you back to your regular doctor to have that conversation, and they can do some of those tests while you're wearing your mask.
Yeah, absolutely. So if you're just joining us, we're here with Dr. Theresa Brennan, Chief Medical Officer here at UI Hospitals and Clinics, and we're talking about your health and safety during the COVID-19 pandemic. Please comment with any questions or concerns you have in the comments, and we'll answer as many of them as we can. So Dr. Brennan, now let's answer some of the questions people have been submitting to us on social media. So several people have asked if there's evidence for the efficacy of wearing masks. And I know we've talked about that they do work, but can we explain the science of it at all?
Yeah, I mean, there's definitely studies looking at the efficacy of masks. I think, to date, more than 70 studies looking at whether masks can and are effective in viruses that are transmitted in this way. And I think it's pretty clear that, for the reasons we talked about, because it's a barrier, because we have source control, because more medical masks, for example, do other things to help protect the wearer, that masks are quite effective. And that's why we keep talking about them.
Lisa from Facebook asks, how safe is it to go to a medical doctor appointment or a dental appointment right now?
Yeah, I think it's pretty universal that it's safe. I think you need to recognize that you're assessing the safety of going versus the safety of not going when you make that decision. So for things that are necessary, for children that need vaccinations, for someone who has new symptoms, to take care of your teeth. I mean, your teeth are really important. Actually, as a cardiologist, it's really important to me that you take care of your teeth, because we know if you don't, it can actually hurt your heart. So those sorts of things are necessary. And I think, in the beginning of COVID-19, of the outbreak, people stopped going because we didn't know how to protect ourselves, and we didn't know if it was safe. And perhaps we felt like this was going to be gone shortly, in a month or two, and we could postpone these things. But I think now we know that, the idea that we can postpone things for a little while and then COVID will be gone is just not the reality. So, so it is safe. And what I started to say is, I think, if you want to be very safe, check into the doctor you're going to, the dentist's office, and ask them what their safety standards are when you make that appointment. Is everyone wearing a face covering? They really should be wearing a medical grade mask. And, we would expect here at the University of Iowa that they're wearing a shield as well. Are they washing their hands? Do they have practices to monitor that people are doing that? Have they set up their waiting rooms so that social distancing can occur? So that it's not the patient's responsibility to tell someone they're too close, but that the seats are really set up so that distancing can occur. Have they enhanced their cleaning practices? These are all the things that we have done here to keep our patients and our staff safe. I think that you will find that is pretty universal in medical clinics or hospitals, but it might vary a little bit. And so to feel most comfortable about your safety, it's reasonable to ask those questions.
Yeah. Well, we have two questions about teachers. So I want to ask those ones. Stephanie asks, if teachers have to teach students in person this year, what would be their best protection? A face mask, a face shield, or both?
Yeah, that's a tough one, right? I think that when you're thinking about interacting with others, whether it be being a teacher, being a healthcare provider, being someone who's working in the community, I think you have to think about yourself and what sort of things are necessary for you. And maybe what limitations you have. You have to think about things like those safety standards, like your face shield or mask. And you have to think about other administrative or epidemiologic practices that we do, like distancing and barriers. And so from the standpoint of masking or shielding, I think you really have to weigh the benefits of each of them. So again, we believe that face shields are effective, but it may not make you comfortable to wear a face shield. You might feel like you need to wear a mask, and that's a personal decision. On the other hand, if you're a teacher that's teaching French, that becomes very hard if you're wearing a mask, right? So a shield may be a reasonable alternative. So I think, again, it goes back to choices. We know that cloth masks are effective. We believe that shields are effective as well, and that they offer other things that may be beneficial to you. For example, if you're teaching kindergartners who may be reaching out to touch your face, a shield might be better. So I think weighing all the options, you have to decide for yourself. And I think until we have more information about how to best have people be protected in school, that I think that you use your best judgment, which is really what we've done so far with COVID, and try to protect yourself. I touched a little bit on the distancing. So, there are things that you can do as a teacher to decrease risk as well. If the windows can be opened, better ventilation is better. Making sure that people are distanced. And in some situations, you might need to have some barriers. So we have put up plexiglass barriers in places where we can't have the normal distancing that we would want to have to protect us from COVID in certain situations. So those barriers might be things to think about in addition to face coverings.
Yeah, I saw that some parks in some cities in the United States are making circles that are 6 feet apart. So, you can kind of congregate with your spouse or whoever you're there with, but you're 6 feet apart from other people. And I thought that might work for some teachers too. I mean, this is a lot of work for the teachers, but maybe they can create little spaces in their room that are marked off and easy to understand of this is how far we need to be away from each other.
That's a great idea.
Yeah. Okay. So I just want to recap. We definitely want teachers to, if they have to teach in person this year, the 3 W's, the wearing a face covering, watching their distance and washing their hands, keeping hand sanitizer in the classroom, opening the windows if possible, and just finding ways to create barriers. Those are your best pieces of advice, right?
Yeah. Or even going outside. I mean, if the weather is good in Iowa, we have a short period of time when that happens, right? After kids go back to school. Yeah. But if the weather's good, can you have class outside? Yeah. I think that's a great idea.
That is a great idea. So our second teacher question comes from Joellen, and she asks, what should teachers do when they come home each day from work if they're teaching in person? Wash their hands, obviously, but should they change their clothes? Do you have any recommendations for how to be safe once at home?
Yeah, I think, again, if you're wearing a cloth face mask, you should wash your face mask every day. We believe that transmission can happen by contact, but we believe that it's probably less prevalent. It's less of a concern than it was originally. Originally, we thought it was a big concern about touching surfaces and touching your face and taking your shoes off and washing your clothes. But I think to be safest, change your clothes when you come in the house and wash them immediately. Don't rewear clothes. Don't let them sit in an area where you might touch them. That's, to be the utmost safe. I think making sure that you're washing your hands before you come into your house is a good idea. I also think one of the big things is what I really started with, is making sure that you're washing that face mask if you're wearing a face mask every day. And if you're using a face shield, to be sure that you're washing that shield as well with disinfectants that actually will make sure that you get rid of that virus if it's there.
Yeah, 70% alcohol or more, right? You want to aim for. Okay. So we've got a couple more school questions. I know that's a concern for a lot of people right now. Linda asks, if my child goes back to school in person, should there be any concerns about them visiting their grandparents?
Probably. We think that children are less likely to show symptoms of COVID-19. When kids are going from being at home and not interacting to going into a situation where it's more social, which school is, there is potential for them to become infected and maybe not know it. So again, practicing those safety standards is really important. I've seen some where people are talking through a window, to have interactions with their grandparents. If it's in the house, teaching the child about, we're not going to hug and kiss grandma and grandpa for now. And why that? I think it's really important to say why, right? Because, children will assume that it may assume that it's something else and be very concerned and scared about that. So I think, practicing those safety standards is really important. I think avoiding contact as much as we can. And that's really hard because we're social beings and, we really want to be with our family. But we just need to do it safely. I think some of that is true whether they go back to school or not. Whether if they have play groups, unless you're, completely certain that the other family is following the same sort of safety standards you are and not going out into social situations where they may contract the disease. I think those things, continue to be challenging for all of us. And so they're probably good practices whether school's in place or not.
Great. So Hope asked, what kind of protections do you recommend doing with our students who have to attend in-person classes this fall? So, what kind of things should they talk to their kids about? And are there certain precautions they should send their kids to school with?
Yeah, I think the teachers are educators and parents are educators. And I think the most important thing is education. I think most of us do things that we're told to do better if we know why we're doing them. And so talking about why are we wearing masks? Why do we need to distance? And making sure that it's really clear to the student before they go back so that they can continue to monitor themselves and make sure they're doing the right thing. I think some sort of face covering is really, really important. Obviously, there are people who can't wear a mask because they're too young. Usually a school-age child would be able to do that. But it is hard for them to not fidget with it and things if they're very young. So, having those conversations, I think it's important for the teachers and the people at school to continually remind. I can tell you when we first started it here at the hospital, we had to continually remind each other, right? Not because anyone had, some sort of malice or aversion. It was just we forget.
Yeah.
So kids need to be reminded as well. And then readily available, as you talked about earlier with the hand hygiene products on your stroller, have a hand sanitizer that they can use when they feel like they need to. Maybe even send them with some wipes so that they can wipe off their desk so that they feel very safe.
Yeah, talking to kids about why it's important to do these precautions can go a really long way. I know my 3-year-old is just one example, but when we go to the park, she says before she gets on the swing, don't touch my face, right? And I'm like, right, don't touch your face. So just like making it a normal part of our lives is hard because we're not even used to it as adults. But if we can do that, kids actually pick up on that as long as we, like you said, we make it consistent and we give lots of reminders.
Right. And I think clarity is important. If the kids are on the internet or if they're listening to the media, they may be hearing things that are contradictory, and that is confusing. And so clarifying what we know and what's important and what we expect in order to keep each other safe is really important.
It's a great point. So we've had a lot of questions recently about what should people with asthma do? We know that face masks maybe aren't the best option and they should talk to their doctor. But are there other things for kids who aren't going to wear a face mask at school because it affects their asthma? Should they just continue to do the social distancing and hand hygiene as much as they can?
Well, they definitely should do that. And then I would think about a shield. And for sure, I would have a conversation with their physician about, what is the risk to this child? I think many schools are offering options of go back to school or do it online. And so having that conversation with the child's physician about what is the best thing for them and how do you make them as safe as they can be. And a shield might be an option.
Great. Thank you for clarifying that, because I think that is a concern for a lot of parents of kids that have asthma. So it's helpful. So I want to shift the topic a little bit. We're going away from school and we're going to talk about vaccines. So we don't have a vaccine for COVID-19 yet. Not yet, but hopefully we'll make headway on this. But there is a promising vaccine being developed by the National Institute of Health. Do you need to answer it?
No.
So can you explain what promising means and what where we're kind of at in this process of working towards a vaccine?
Sure. So I think promising means three things. One is that it doesn't hurt people. There's no significant side effects. The second is that it causes the person who gets the vaccine to create antibodies. And the third is that those antibodies actually affect the course of the virus and prevent someone from having an infection. They might be exposed, but they don't get the infection. And so I think that it's great news that we have some promising vaccine or vaccines on the horizon. I was talking to a friend the other day and they said, yeah, so we should have it by school time, right? No, it takes a long time. So any medication or vaccine that has to go through FDA approval has to go through a series of steps. And the first step really is in the laboratory to see what happens in cells. So they've surpassed that. The second is to see if it's safe for people. And many times those safety trials vary the dose. So we know what the optimal dose is and can see that it has an effect or it doesn't have an effect. What's the right dose? Does it have a side effect that would preclude us from giving it to people? And then that's when the biggest part starts, which is trialing the vaccine on a large group of people. And that's where this vaccine is headed. They'll give the vaccine to, I believe, about 30,000 people, and then they'll watch. So it will be a randomized trial where there'll be a core group of people that don't get the vaccine, and there'll be a core group of people that do. They'll monitor for side effects in all of those people, even though it seems like it's been safe in the smaller group of people. And then they'll look to see if they develop antibodies. And then they'll look to see if there's a difference in the two groups with the number of people who become infected just in normal life. Of course, we would never expose people to COVID and see if they get infected. So it may take a while for this, for the results to be clear that a vaccine is effective.
Okay. Well, thank you for telling us a little bit about that process, because that's helpful to know. Because like you said, it can feel like, oh, great, there's a vaccine coming, but it's good to know that there's a whole process with it, and it could be a little while still. So it's important to continue to do precautions.
Absolutely. But I do think we should be excited about the fact that there is some promise on the horizon.
Yeah.
That this could happen in the future. Maybe not in the near future, but in the future.
Yeah, scientists and researchers are really hitting the ground hard to try to find this vaccine, which we're very grateful for.
Yes.
So before I let you go, I just want to recap. We should be making sure to avoid close contact with others and closed spaces with poor ventilation. We should be remembering the 3 W's: the wear your face mask or shield, watch your distance from others, and wash your hands.
Yes.
And we should be reaching out to our doctors if we have concerns about face coverings, COVID-19 symptoms, or just our physical or mental health in general. Is there anything else I'm forgetting?
Yeah, I would add 2 things. One is, I really love the phrase "wear it now so we don't have to wear them later," right? So if we can decrease the transmission by wearing our face coverings now, it'll make school safer when school happens in a month, right? Yeah. It'll make all sorts of things safer for many of us, and so really a concerted effort to wear your mask, wear your shield, whatever your choice is. Wear a face covering. And then the last thing I would just say is one of the questions that came up: is it safe to get my medical care? Mm-hmm. And please don't avoid getting medical care for something that is real, like new symptoms, like a known condition, like a new lump somewhere, because you're concerned about something that is possible. So really important to make sure you take care of yourself and get the medical care you need, and the dental care, of course.
Yes.
And not be concerned. I can tell you that I've had so many patients that have been so pleased and impressed with our staff because of the things that they are doing here. And I'm sure that happens in many, many, many hospitals. But when patients come here, they feel comfortable. And that's what we all want as healthcare providers, that when patients come to us, that they feel comfortable, that we're keeping them safe. And though we still learn about COVID, I think we've learned a lot, and we know a lot more than we did. And I think we know how to keep people safe. So get the medical care you need.
Absolutely. Well, thank you so much for joining us and sharing your expertise with us today, Dr. Brennan.
You bet. Happy to be here.
And thanks so much to everyone who tuned in today. If you joined us after we started chatting, make sure to go back to the beginning to get all of the great information Dr. Brennan provided us with today. And make sure to stay tuned to our social media accounts and check out our Epi Explains videos for all the great information from our epidemiology team. Lastly, please remember, wash your hands, watch your distance, and wear your face coverings, and take care of your physical and mental health. Thank you for watching.
Thanks so much.